Hi, my name is Dr. Carla Muñoz-Esquivel, and today I'm going to present to you MAST framework. Currently, we live in an environment where there is a boom of e-health products. The life science industry is facing radical changes, and this is owed to the intersection of machine learning, technology, digitalization, additive manufacturing, and 3D modeling. So innovations will be delivered at a speed and cost that previously was not possible. However, this requires investment. So there are many evaluation models and theoretical frameworks that can be used as a basis to evaluate e-health technologies, for example, telemedicine, and none has been used extensively yet. And one of these evaluation models or frameworks is the Model for Assessment of Telemedicine, the MAST framework. It was originated from an EU net HTA project where HTA corresponds to health technology assessment and focuses on measuring the effectiveness and the quality of care. It represents a multidisciplinary process which assesses the medical, social, economic, and ethical aspects of telemedicine and is key to decide whether or not to implement telemedicine services in healthcare systems. However, in IT4Anxiety, the Ulster team is observing if the MAST framework as it stands can be used to guide assessment of any kind of health technology, or if it requires any changes. What assessments are needed? The assessment should try to include all relevant outcomes of telemedicine or the technology for the patient, clinician, healthcare institutions, and society in general. Can additional assessments be included? Yes, but assessments should be based on scientific studies and methods and scientific criteria for the quality of evidence. You, as a startup, decide which outcomes are included in the assessment, since it depends on the available scope, time, and money. And it's important to observe that the outcomes in the MAST are divided into 7 domains. However, a minimum of the conditions should be included. What is this minimum of conditions? So the step 0 ensures assessing the attainment of the main outcomes. Step 1 ensures to consider legislation, reimbursement, maturity, safeness, feasibility, and effectiveness. Once that you cover at least the bare minimum, you can pass to the step 2, which is assessed according to the relevant or all the MAST outcomes. So the MAST framework, step 0, attaining the main outcomes. What is the aim of the telemedicine or technology main outcomes? So this should include a description of the patients and the health problem. Also, what are the relevant alternatives to solve this problem, and the solution must be compared against the alternatives, the current treatment employed so far, or an improved upgraded solution technology. What is the bare minimum? Step 1. So this is a minimum of the following conditions. Legislation. Does the telemedicine service solution fit into the existing legislation? Does the implementation of the solution is according to national and regional legislation, which should be in line with EU legislation? This is very important. Is care at distance allowed, or does it require a persistent relationship between the healthcare provider and the patient, and include legislation for medical care provision? Are there special rules about accrediting telecare providers? Accreditation systems for care providers? The current rules of liability include providers outside the physical control of the primary care providers. The reimbursement is money that national or regional healthcare authorities and insurance companies pay. Is the telemedicine service solution reimbursed? Is the reimbursement a problem? If yes, it should be considered to let the national health authorities produce the assessment, or to invoice both national institutions, like the National Board of Health, in the production of the assessment to use the assessment report as the basis for changing reimbursement. A minimum of the following conditions should be also considered: the maturity, the safeness, the feasibility, and the effectiveness. How mature is the solution telemedicine application? Is the application solution safe to use by end users? How telemedicine or the solution can be implemented in practice and in qualitative studies? Is telemedicine or the solution effective in solving the end user's problem or problems? The number of participants and training. What is the relevant number of patients expected to use the application? Do clinical staff need training in the use of the solution or telemedicine? Does the organization need to change work or its planning to implement the solution? Step 2 is the assessment according to the relevant or all the MAST outcomes. So there are 7 domains. It is the health problem and the characteristics of the application, safety, clinical effectiveness, patient perspectives, economic aspects, organizational aspects, sociocultural, ethical, and legal aspects. However, there is an 8th domain that is circumstantial and that we might assess in IT4Anxiety, that is the assessment of transferability. So the first domain is the health problem and the characteristics of the application. This is related to assess factors related to the background of the application, which are information pieces needed when conducting the assessment. The elements of this domain overlap with elements of the economic and the organizational domains. The topics included in this domain are the description of the patient's health problem, the patient expecting to use the application solution, what is the burden caused by the health problem on the individual and the society, and the description of the application. The regulatory status of the application or the solution provides information to construct economical or organizational models to assess the impact of introducing technology and promoting its utilization among stakeholders. The requirements for using the application solution. This helps to choose the most appropriate research questions, outcomes, and decide the methodology to assess other domains. The technical characteristics of the solution, for example, the infrastructure, the interoperability between administrative systems, user support, help desk functions, backup systems and procedures, databases, etc., and other organizations involved. The second domain is related to safety. It refers to the identification and the assessment of the harms. For example, errors in diagnostic management might happen from using telemedicine or the tech solution, which can harm the patient. Safety issues can be divided into types. The clinical safety is related to the assessment of harms for the patient's staff using telemedicine, the tech solution, and the side effects of the technology. This is based on a description of the types of harms, their incidence, and their severity. The technical safety is related to the technical reliability of the technical application and involves the evaluation of backup, inference, and security of data. Patient safety and clinical safety are highly intertwined. Collected data can be divided into information about patient safety and information about technical issues. Third domain is the clinical effectiveness, and it refers to the performance of the technology in regular clinical practice. Efficacy refers to the health benefits of a tech solution or telemedicine application for the patient under ideal circumstances, carefully controlled conditions. Efficacy is studied using controlled randomized trials, where patients are selected under strict criteria. However, to determine effectiveness, the effects may be studied under more pragmatic conditions. Could be a pragmatic randomized controlled trial, or judgments about the size of expected effects under ordinary circumstances can be made based on RCTs. So the particular outcome measures that are used to evaluate depending on the relevant topics and issues. It's sensible to use validated outcome measures when appropriate and available to facilitate comparison to other studies like SF36 or SF12. To estimate the health benefits of telemedicine tech applications, several patients, interventions, comparator, and outcomes questions must be answered. How is the patient group described? What is the intervention to be assessed? What alternative is intervention going to be compared to? What measurable outcomes for assessing effectiveness and safety are relevant? It's important to mention that the clinical effectiveness is very intertwined with the safety and the economic domains. Topics that can be included in the assessment of clinical effectiveness are effects on mortality, effects on morbidity, and effects on the health-related quality of life, and generic measures of quality of life, disease-specific measures of quality of life, behavioral outcomes like exercise, utilization of health services like the number of readmissions to the hospital. The fourth domain of the MAST framework is about patients' perspectives. This domain refers to all these issues related to the patients and this relative perception and satisfaction, but also about the perception of healthcare professionals. These are relevant if the tech solution or the telemedicine affects the way healthcare is delivered to patients, the way they interact to communicate with the clinical staff, or if this changes their perception overall treatment process. So the definition of patient satisfaction is the fulfillment of the expectation or perceived needs of the patients. However, in practice, it is difficult to define which kinds of perceptions, expectations, or preferences should be included in the assessment. So some examples are feelings, experiences, and comfort, professional-patient interaction, timeliness and convenience, overall satisfaction, preference between face-to-face and telemedicine, privacy and confidentiality, professional competence, personal manner, technological informativeness, and potential for future use and usefulness. Sometimes patient acceptability, confidence, or self-efficacy empowerment are used as synonyms, but there are very few validated instruments to assess them. Also, the telemedicine applications or the tech solutions can have effects on how and to what extent the relatives are helping and caring. For family members with diseases, for example, people with dementia, Topics that can be included in this assessment are the satisfaction and acceptance, the understanding of information, confidence in the treatment, ability to use the application, and the access, and also empowerment and self-efficacy. The fifth domain is about the economic aspects. This refers to the economic aspects of the telemedicine tech application, and this is highly relevant at the society and hospital levels since the cost of healthcare is rising, and there are limited resources and institutions that have to decide whether or not to implement solutions. The economic aspects that can be described are the societal economical evaluation, comparing a telemedicine tech application with other relevant alternatives in terms of both their costs and their consequences. The health economic evaluation, that this can have many forms, like for example the cost minimization analysis that refers which interventions is the least costly. The number 2 is about cost effectiveness analysis. What is the intervention incremental cost per additional unit of the outcome as compared to its best alternative? Or a cost utility analysis. What is interventions incremental costs per additional unit of the outcome as compared to the best alternative? Or a cost-benefit analysis. What is the economic trade-off between different activities that matter for society? Analysis of expenditure and revenues for the healthcare institutions using the telemedicine, the tech application, and for this you can do a business case or analysis of return of investment. We have the economic evaluation, that is the societal perspective, can focus on the amount of resources used when delivering the assessed telemedicine tech application and its comparators in the healthcare sector and other sectors. The different types of resources that can be part of this analysis are investments in equipment, training of staff, maintenance, use of staff for each of the relevant types of staff, medication, utensils, patients' use of time, relatives' use of time, and transportation. Unit costs or prices for each resource used. Related changes in the use of healthcare resources like primary care, emergency unit, outpatient visits, hospitalization, bed days, and tertiary care. Clinical effectiveness of the telemedicine tech application and comparators to be used in the cost effectiveness analysis. And in the business case, is something that happens at the institutional level. So the expenditures per year, including expenditures related to the resource use described in the cost estimation above, and revenue per year, like the activity, the number of patients or services, the reimbursement per service or per patient. The sixth domain is the organizational aspect, considering what kind of resources have to be mobilized and organized when implementing a new application, and what kind of changes or consequences the use can further cause in the organization. Healthcare organizations are complex and dynamic, and therefore multiple approaches are often required for the analysis of organization aspects. It's important to notice that the effects of telemedicine tech applications on the use of human resources will depend on the degree of interoperability. So the degree to which the application works together with other electronic systems in the healthcare system and the organization is very important. So the organization domain is crucial when it comes to evaluating telemedicine technology services because implementation of the solution often changes the working routines or the distribution of tasks between health professionals for healthcare providers. Even though models aim at suggesting outcomes which can be isolated and measured through a reasonable effort, descriptions in the various processes and the organizational relations often include description or relations and diagrams rather than statistical measures. So we have that the topics that can be assessed in the organizational aspects are, for example, the processes, the workflows, the staff training and resources, interaction and communication, how it's structured, spread of the technology, centralization or decentralization, economy, and also we can see the culture, the attitude and culture and the management. The relevant methods for data collection may include both qualitative and quantitative methods. Qualitative methods are interviews or observations. Quantitative methods are surveys and registration of data. Our seventh domain is about the sociocultural, ethical, and legal aspects. The sociocultural aspects focus on more general sociocultural implications of telemedicine applications. The diverse sociocultural arenas like hospital, general practitioners, everyday life, homes, schools, workplaces, etc., where the patient lives and acts during the use of the application. The implications of its use for patients may extend far beyond the healthcare setting. Patients may have considerations, worries, and experiences both before, during, and after the application has been put to use. The topics that can fit here are the changes in the patient's role in major life areas, their social life, their working life, patients' relatives, and others' understanding of the telemedicine tech application. societal, political context, and changes. Will the application influence the general model for the delivery of healthcare services if deployed? Changes in responsibility. Are the patients and/or relatives capable of handling the responsibility? Gender uses. Has the service any consequences on the position of gender? The ethical aspects. These consider the prevalent morals, values, and behavioral models of society relevant for the assessment of the tech solution in ethical analysis. And the topics that can come here are overall questions, does the application challenge religious, cultural, or moral beliefs? Potential ethical problems like giving the responsibility to the patients, autonomy, is the patient's autonomy challenged or increased? And then equity among different groups in society. We have the legal aspects. These refer to the legal obligations which must be met and will identify any specific legal barriers that may exist to the implementation of the application. The legal assessment will have to be conducted in 2 steps. The first step, there will have to be an assessment of the readiness of the existing legal framework to accommodate telemedicine or technology approaches. Then the other thing is assessing which particular regulatory requirements will affect a given telemedicine tech application. Consequences of implementing or not implementing it. So the issues considered are clinician accreditation, information governance, and professional liability. The clinician accreditation, it refers to if clinicians are accredited to deliver services at a distance, and is their accreditation accepted at the point of delivery where the patient resides, as well as the legal registration location of the clinician. Also, the information governance are all the necessary aspects of transfer and access to patient identifiable information duly considered. And then the professional liability that is closely associated with the issues of accreditation need to ensure that the flow and share in liability is clear across different actors in the telemedicine or the technology systems. In the topics that are important to consider is the clinical accreditation, the information governance, the professional liability, and the patient control, consent, and access. When an assessment of a telemedicine tech application includes the collection and analysis of data from new studies, an assessment must also include consideration of whether the results can be generalized from one setting to another, and this consideration should be made within each of the 7 domains. So some examples is the assessment of the clinical outcomes should include some kind of analysis of whether the circumstances during the trial were so special and controlled that the same results cannot be expected in real-life effectiveness. Another example is the cost-effectiveness, which may vary between countries or locations because of difference in basic demography and epidemiology of the disease, difference in the availability of healthcare resources, and variations in clinical practice, difference in incentives to healthcare professionals and institutions, in reimbursement systems, and difference in relative prices and costs in prices in different types of healthcare professionals, and difference in population values. The MAST check compliance in the context of IT4Anxiety. The Ulster team checks on the MAST compliance once the startup submitted for first time the ethics application for review. How the process looks like. Uses as a guidance a series of questions in a Google form, and 3 independent reviewers carry on the review. Results then are compiled and processed. A response letter is submitted to the startup, and comments and feedback should be addressed in the ethics application, and a response must be drafted. Ulster team reviews the comments and feedback were addressed before the IT4Anxiety Ethics Committee can take a look. In conclusion, healthcare solutions need evidence of their effectiveness and quality of care, and the MAST framework is one of the frameworks that can be used to assess telemedicine or tech solutions. It represents a multidisciplinary process which assesses the medical, social, economic, and ethic aspects of telemedicine, and the MAST is key to decide whether or not to implement telemedicine services in the healthcare systems. It's comprised on 7 domains according to circumstances, and 8 domains might be evaluated. So we are evaluating the 8 domains in IT4Anxiety when applicable. Tech solutions must be mature to be assessed. If not, assessment will fail. In the assessment can consider relevant or all MAST domains. Steps 0 to 1 must be considered, and they represent the minimal necessary. And Ulster team will review the MAST compliance of all ethics applications submitted in the IT4Anxiety project by startups. Only when all comments and feedback are addressed, the application can be reviewed by the ethics committee.